Hello, my name is Kosi Anyebunam, a nursing student at Seneca College. Today, I'll be performing some health assessment on my patient. Here is the 360 view of my room, and this is my potential patient. Good. I just walked into my patient's room. I sanitize my hand, wipe my stethoscope, and put on my gloves. Hi, good afternoon. My name is Kosi. I'm a student nurse, and I'll be assessing you today. Can you tell me your name and your date of birth, please?
Chidi Tintin.
Okay, thank you. I'll be providing some privacy for you. And do you permit me to go ahead with the assessment? Good. Okay. Patient is a 35-year-old man who I met sitting in the chair comfortably. Patient is having some difficulty breathing, cough intermittently, and there is a loud wheezing sound. Patient is tired, and there is some little discoloration on the mouth. Patient is look his age, his height is normal for his age, and his weight is normal for his height. On looking at on his skin, the color of the skin is brown. The skin is intact. There is no obvious region of the skin. The skin is normal, not warm, and the texture is normal. There is no area of tenderness on the skin, on palpation. Okay. The the skin the skin is normal bilaterally. The the skin is flushed and diaphoretic. The the body part is equal bilaterally. Can you please stand up? Patient's posture is normal. Is stood up without any discomfort. Can you please walk around? I want to see your gait. Good. Okay, you can sit. Patient walks normally. There is no obvious gait deformity. He swings his hands bilaterally while walking. Patient maintains good eye contact. There is no and communicates very well with the examiner. The speech is with articulated speech, except for shortness of breath that is experienced, and short sentences, short phrases because of shortness of breath. The patient look clean and well groomed. I want you to tell me the time of the day. Do you know where you are and the time of the day?
I'm in my house and it's 12 o'clock.
Okay, patient is well oriented and alert. There is labored breathing in the patient. The vital signs, the BP of the patient is 142/80. The pulse rate, which is high, the pulse rate is 120 beats per minute. The respiratory rate is 30, which is tachycardia, high. The respiratory rate is 24 beats per breath per minute, which is equally high, tachypnea. The temperature is 37.1 degrees Celsius, and the oxygen saturation rate is 92%, which is low. A local assessment on the face, the facial muscle look tense, the face look tensed and tired. The facial muscles are normal, not tight. The facial features are equal bilaterally. The eyes, the eyebrows are equal. The nasolabial folds and the mouth corner of the mouth are equal bilaterally. The skin of the face are uniform. There is no hyperpigmentation except for the mouth that have cyanosis, and the nail bed that has cyanosis. The capillary refill is take more than 1 to 2 seconds to refill. The texture, the texture of the skin is normal, and the face is well moisturized. Can you please close your eyes? Good. Hold it tight. Good. Open. Can you please smile? Open your eyes. Can you smile? Good. Can you frown your face? Okay. Can you pop up your cheeks? Good. The cranial nerve, 7 facial nerves is intact. I'll look at the chest, the back, the posterior chest. The spinal process are in straight line. The scapula are in symmetrical. The shape and the configuration of the chest is normal. There is no obvious deformity of the chest. There is no scoliosis or kyphosis. The chest expansion, I will use my landmark between T9 and T10. And I'll place my hand together. Breathe in, out. Good. Chest expansion is equal bilaterally, though somehow limited. Any pain? No pain. Good. The skin is intact and moisturized. There's no obvious skin discoloration. I'll do some percussion. There is hyperresonance of the lung field. I'll listen to the breath sound. I will listen to the bronchial sound. Take a deep breath, and if you feel pain, you stop. Okay? Breathe in, out. Any pain? No. Okay. Breathe in, out. Breathe in. I will check for the bronchial sound and vesicular sound and bronchovesicular sound. The breath sounds are reduced, and there is obvious wheezing of the obvious wheezing of the sounds. The rate of the breathing is high. The breathing rate is high. The intensity is reduced. Then for the chest, I'll palpate the anatomical space for the heart sounds. I'll locate this is the second intercostal space. Second right intercostal space is for the apical sound. It's for the aortic valve. Then second left intercostal space is for the pulmonic. Then third left intercostal space is for the EPS. Fifth left intercostal space is for the tricuspid, and the fifth left intercostal space, mid-clavicular, is for the mitral. Then I will listen for the sounds. At the second right intercostal space, which is at the aortic valve, the S2 is louder than the S1. At the second left intercostal space, which is the pulmonic, the S2 is louder than the S1. At the third left intercostal space are the EPS. The S1 and S2 are equal. On the fifth left intercostal space, which is the tricuspid, the S1 is louder than the S2. At the fifth intercostal space, mid-clavicular, which is at the mitral valve, the S1 is louder than the S2. So at the apex of the heart, S1 is loudest. Then at the base of the heart, S2 is loudest. Then I will listen for additional sound with my belt part of my stethoscope. There is no murmur, but there is wheezing sound heard. Then I will listen at the epical heart rate, which is at the fifth intercostal space. I will listen for 1 minute, and the heart rate is 120 beats per minute, which is high, abnormal, and the rate is normal. The breathing rate is high, but the reading is normal. Thank you.
Thank you.